Have you ever noticed saliva on your pillow after sleeping and wondered why it happens? It's a question that has puzzled many of us. It turns out, drooling while you sleep is quite a common occurrence. Like many things our bodies do, there's an array of reasons why this might be happening, some more familiar than others. From natural sleep cycles to health conditions, the causes are as varied as they are intriguing. In this video, we'll delve into the causes of drooling during sleep. Before we dive into the causes, it's crucial to understand what drooling is. Drooling or sialorrhea is the term used to describe the excess production of saliva that can unintentionally leak out from the mouth. Now, saliva itself is a necessary part of our physiology. It's not just water, but a cocktail of enzymes, electrolytes, and mucus that plays a key role in our overall health. It kickstarts the digestion process by breaking down food, and it helps maintain the health of our mouth by neutralizing acids and washing away food particles. Plus, it keeps our mouths moist, which is essential for speaking, tasting, and swallowing. But when we produce more saliva than our mouth can accommodate, or if we have difficulty swallowing it, that's when drooling can occur. Now that we know what drooling is, let's explore why it happens during sleep. There are numerous reasons why one might drool in their sleep. Let's start by discussing two common causes: sleeping position and certain types of medication. Firstly, the way we position ourselves during sleep can highly influence whether we drool or not. If you're a side sleeper or a stomach sleeper, you're more likely to drool. Here's why. When you sleep on your back, gravity helps keep saliva inside your mouth. But when you sleep on your side or stomach, gravity isn't on your side anymore, and saliva can easily escape from your mouth and onto your pillow. Moreover, the position of your head can also play a significant role. If your head is tilted downwards, it can create a natural pathway for saliva to flow out. It's interesting, isn't it? Something as simple as your sleeping position can turn you into a nighttime drooler. Now let's talk about the second common cause of drooling: certain types of medication. You might be surprised to learn that some medications can increase saliva production, which can lead to drooling. These medications include those used for allergies, acid reflux, and certain psychiatric disorders, among others. Antipsychotic drugs, for instance, can stimulate the salivary glands to produce more saliva. Antihistamines, on the other hand, are known to cause dry mouth, but in some people, they can have the opposite effect and increase saliva production. Also, medications used for acid reflux often work by reducing stomach acid and increasing saliva production, as saliva helps neutralize acid. This increased saliva production can sometimes lead to drooling, especially during sleep when we're not swallowing as frequently. So, if you've recently started a new medication and have noticed an increase in drooling, it might be worth discussing this side effect with your doctor. They can potentially adjust your dosage or suggest an alternative medication that doesn't have this side effect. These are just a couple of reasons, but the causes don't end here. There's more to this drooling saga, and we'll continue to delve deeper in the next segment. Stay tuned. Continuing from where we left off, let's delve into more causes of drooling. Sinus congestion and neurological conditions are two more factors that can contribute to this somewhat perplexing phenomenon. First up, sinus congestion. Picture this: you're sleeping peacefully, but your nose is blocked. It's like a traffic jam up there, and your body needs another route for air. So, what happens next? You start breathing through your mouth. Now, this doesn't seem like a big deal until you wake up and find your pillow a little more damp than you'd prefer. The reason? When you breathe through your mouth, your salivary glands get a green signal to produce more saliva, and the result is drooling. It's your body's way of keeping your mouth from drying out. Now let's switch lanes and talk about neurological conditions. These are conditions that affect the nerves and muscles in your body. Parkinson's disease, cerebral palsy, and stroke are a few examples. These conditions can impact the way your body controls saliva production and swallowing. For instance, if a condition decreases your ability to sense saliva buildup or affects your swallowing reflex, drooling can occur. It's like having a faucet that's always on, but the drain isn't working properly. You can imagine the overflow. To put it simply, when the muscles controlling your saliva don't work as they should, you may end up drooling. It's not something to be embarrassed about. It's just your body doing its thing, albeit a little differently. So there we have it. Sinus congestion and neurological conditions can both lead to drooling. It's important to remember that while drooling can be inconvenient and sometimes embarrassing, it's often a natural response of the body or a symptom of underlying health conditions. Understanding these causes can help you manage the issue more effectively. To wrap up, let's quickly revisit the main points we've discussed. We began our journey by defining drooling as the unintentional leakage of saliva from the mouth, a phenomenon that most of us have experienced at some point or another. The first cause we examined was sleeping position. If you're a side or stomach sleeper, gravity can cause saliva to escape from your mouth. If drooling is becoming a nuisance, it may be worth trying to train yourself to sleep on your back. Next, we moved on to the role of medication. Certain medicines, particularly those used to treat mental health conditions, can cause excessive saliva production leading to drooling. If you suspect your medication is causing you to drool, it's important to consult with your healthcare provider. We then talked about sinus congestion. A blocked nose can force you to breathe through your mouth, which can result in drooling. So, if you often wake up with a wet pillow during allergy season or when you have a cold, this could be the culprit. Lastly, we delved into neurological conditions. Conditions such as Parkinson's disease and stroke can impact the nerves controlling the muscles around the mouth, leading to drooling. But remember, while it might be a little embarrassing, drooling is a common occurrence and usually not a cause for concern. It's simply a sign that your body is producing saliva to keep your mouth moist and defend against tooth decay. So next time you wake up to a wet pillow, remember, it's just your body doing its thing.